Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. Today we're going to be talking about kidneys and how even though diabetes can affect the kidney, there is just so much now we're able to do to keep our kidneys healthy and working well. Remember, the kidneys are our friends, and we need to treat our friends nicely. They help us. The kidneys actually help the body get rid of our toxins, and we're going to talk about, over the course of this podcast, what we can do to keep our kidneys healthy. I'm Dr. Neil Skolnik, professor of family and community medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me is my co-host.
I'm Dr. Sarah Wettergreen. I'm an assistant professor in the Department of Clinical Pharmacy at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. In this role, I practice as an ambulatory care clinical pharmacist at the UC Health Lone Tree Primary Care Clinic.
And today we've got some great guests. To talk about the kidneys, we have one of the country's leading experts on diabetes and kidney disease, Dr. Holly Kramer. Dr. Kramer is a professor of public health sciences and medicine in the Division of Nephrology and Hypertension at Loyola University in Chicago. She is the engagement editor at the American Journal of Kidney Diseases, is a past president of the National Kidney Foundation, is just a plain all-around wonderful person as well. Welcome, Holly.
Hi, thanks so much for having me.
It is a pleasure to have you joining us. Also joining us is Tiffani Martin. Tiffani has lived with type 1 diabetes for over 20 years and now has a passion for helping others avoid complications of diabetes. We'll hear more about Tiffani's story in a little bit. Welcome, Tiffani.
Thank you for having me.
Sarah, can I turn the floor over to you now to talk about why kidneys are important and why we need to pay attention to them and protect them?
I love what you said at the beginning, Neil, that our kidneys are friends and you look out for your friends and protect them. And that's just how we want to treat our kidneys. We might know that kidneys are like filters for the body. Many people might be aware that kidneys remove waste products and extra fluid from the body. As a pharmacist, I also tend to think about the role of the kidneys in removing certain medications from the body. But the kidneys have even more functions than you might think. They help produce certain hormones, create an active form of vitamin D to help build strong bones, and they control the production of red blood cells. The kidneys do so much for us. The challenge that we know about is that diabetes is the leading cause of kidney disease, and about 1 out of every 3 adults living with diabetes also has kidney disease. This includes both those with type 1 or type 2 diabetes. Kidney disease is a condition that can worsen over time as well, which is why we have this emphasis on protecting them to at least delay the progression of kidney disease or help to prevent kidney disease from happening. When kidney disease gets to a later stage, it then is termed end-stage kidney disease, which requires dialysis to manage. We know as well that of people who require dialysis, just under half of these individuals have kidney disease due to diabetes. Now, that all might sound a little bit scary, but there are certainly many ways that the risk of kidney disease can be decreased, which we'll be talking about today.
That's great. Thanks so much, Sarah. And, it really is amazing. We live in these great times where, and we'll talk about it in a little bit, Holly and I began practicing medicine around the same time, which is a few years ago. And there just wasn't a lot we were able to do if we go back a number of years. And we're going to hear how much we now are able to do to protect the kidneys and to slow any progression of diabetic kidney disease. But first, Tiffani, I said we come back to your story, and I'd like to now. Can you tell us a little bit about yourself, and particularly can you focus on your experience with kidney disease and diabetes?
Sure. So when I was at the age of 5, seems so long ago, actually it'll be 30 years in May, which is also my kidney anniversary. but I will get to that in a minute. But
Mm.
at age 5, I was diagnosed with juvenile type 1 diabetes, and I had very supportive parents. It did run prominent in my family on both sides, so we were fully aware of symptoms and what could happen. And, we had a great team that let us know, all of the preventive measures in order for, to manage type 1 diabetes and not let it progress to the point of, where it's uncontrollable. So going through those adolescent ages or age, there's a little bit of rebellion and everything. And in spite of all of the hard work and support that my parents showed, just, going through those transitional years was a little difficult for me. And I know, anybody that has had, juvenile diabetes since they were a kid, understand those challenges. You want to be out with your friends and socialize and do all the fun things that all of your friends do. And then just trying to manage it seems like it's just imposing on your day-to-day life. And so when I got to college, you're away from home and that protective shell and just really independent. And it's on you to, manage the insulin, your intake, your consumption, and making sure you're working out and not, spending time in the library, just eating, whatever you can get your hands on and sports drinks and energy drinks all night, for one-nighters, all-nighters. And so it just kind of progressed. And after that, I ended up getting a job that required me to spend a lot of time on the road. And you can imagine just trying to keep a healthy diet when you're in different countries and you can't eat everything, it's just your food options are very limited, and time zone changes and all of those things. It just became um, it wasn't a priority. I didn't make it a priority as well as I should have. And now that I'm older, I realized that as opposed to it being something that just infringed on my life, I could have very well just incorporated into it and made it just another task as we do, when we wake up and we brush our teeth, just thinking of it as just overall maintenance. So with that poor management, when I turned 27, I noticed some slight symptoms there were some flurries in my left eye. And one day I woke up after weeks of those little flurries and realized that my entire left eye was just bloodshot red. And so from there, we learned that I had developed diabetic retinopathy. And then I noticed that there were some complications when I went to sleep, having a hard time breathing, shortness of breath. I noticed that my limbs were swollen or um, lack of urination and just my food consumption. And it just became very noticeable in my day to day, just very sluggish and lethargic. So when we went to go check with our doctor, I had realized, well, they let me know that I was at stage 4 renal failure. And it just seemed like overnight, I went from being completely independent to losing my sight, getting on peritoneal dialysis at the time, and temporarily losing my ability to walk due to some complications with the medications that I was on. So there was a complete life change. I, lost my beautiful red sports car that I had worked so hard
Mm.
for. I lost my apartment downtown, had to move back home and just get readjusted to life. And so I fast forward, I got a pancreas kidney transplant about less than 2 years later. And when I got the go ahead and I went back to work and everything, I had ended up marrying the love of my life about a year after that. And 2 months after we had gotten married, um, what we thought were pregnancy symptoms ended up being kidney rejection. And so we spent the next year just really trying to combat that kidney rejection with um, different treatments, going in and out of the hospital, staying
Mhm.
in for months on end. And then finally in 2020, actually on my birthday is when I got put back on dialysis chemo this time. And I spent a year and a half until my best friend ended up giving me her kidney last year, May 17th. And so this year I'm coming up. I have a doctor's appointment, a checkup next Tuesday. I have a really good relationship with my doctor and my kidney coordinating team, and I'm really excited about coming up on this milestone. But it can be managed. Um, I have some Gatorade beside me right now. I'm about to. I have my medicine, on my watch to let me know, but I'm
Hmm.
really on top of it. But you can really incorporate it in your life and manage it so you don't end up, like me, and losing
Mm,
a faculty and independence and,
mm.
all of those things. So
That's such an impactful story. And Tiffany, thank you so much for sharing that. You've certainly learned a lot along the way, and now you're in an advocacy role where you're able to share your story with others to encourage them. My first question for you is, what advice do you have for those who are in a similar situation to where you were in your early 20s, where so many people living with diabetes might feel overwhelmed by all the self management tasks they do day to day, injecting insulin, maybe taking other medications, monitoring their glucose, checking their feet, getting the lab tests. We know it's so much. So, going through what you've been through, what are some key points of advice you might have for others?
well, one thing I would like to encourage people is to like combat the fear. Like one thing I think that people just kind of paralyze themselves in their ways is they let fear of the unknown just have them stuck in a place where they're unable to function properly. And I think the greatest thing that happened with all of this was the education that came with it. The more I was informed, the more I was inclined to uh, be proactive, when it pertains to my health, just really understanding my body, how, I respond to different things. A lot of times we look at food as just comfort or, just a means just to, settle a grumbling tummy, but it really is energy and fuel. And if you get it right, your diet right, it really can help you move forward. Um, Everything can be done in moderation. And that was one thing that early in the 90s, it seems so far ago that wasn't the case. It was really like, you just absolutely can't do this and you can't absolutely do that. So you were kind of scared to do anything. And the older I got, it was no, if you are working out regularly, if you're taking your insulin, if you're on top of it, you can have, certain things just in moderation. So, of course, the more knowledge we get, the more studies, the more great, people, we have like you guys that are doing the work and the research behind it and informing us, it better makes the situation open to learn more and to combat those fears in order to make it a part of our lives. And I always say if you can get the family unit, around it, you can actually change a community. And I know with the African American community, it's very prominent, both, um, well, not both, but all three, when you're talking about diabetes, kidney disease, or just blood pressure, high blood pressure. All of those are very centered around uh, dietary habits, everyday things like that. So,
Yeah,
um,
you were exactly right. So you're hitting the nail on the head there. Those are the contributing factors. We're looking not only at diabetes, but other things like high blood pressure that can also increase the risk of harm to the kidneys. And so we have to think about all these different ways that we can help protect them. And what a gift. We were saying how our kidney is a friend, and you have your friend's kidney now. So that's an extra special gift there. But I think you have so many encouraging messages there. In my own practice, I often will ask individuals that I'm working with their diabetes, what motivates you? How do you stay energized to keep going forward with all of these? And I often get comments like, I want to keep all my toes, or I'd like to keep my kidneys. So I think if someone can use that motivation to keep them going with these self-management behaviors while also finding ways to reduce their risk, I think will be the ultimate win. Neil,
Uh,
other
Oh,
thoughts?
I so agree, and I'll be interested. I love the emphasis on fundamentals, Tiffany. And you're so right. Like particularly as teenagers, but but let's face it, even as adults, it's hard to keep your eye on the ball. It's hard to do the things that you know you should. And sometimes we're so busy, we forget just even to eat right and exercise. I'll be interested to hear Holly's thoughts on whether that's important for kidneys as well, from the point of view of a kidney specialist who uses the fanciest medicines in the world, right? But I think Tiffany, your point, and I love the term you used, empowered, that you make it a priority, you incorporate it into your life. And that really is what our program, what this podcast is about, is empowering our listeners to take their lives into their own hands, like you are saying, to learn the knowledge and gain the skills in order to move forward in a healthy way. I'd like to turn now to Dr. Kramer. Holly, a lot has changed over the last 20 plus years with regard to our ability to protect the kidneys. Can you put that in perspective for us? Tell us a bit about those changes and what our listeners can do to help protect their own kidneys.
Yeah, so much has changed. So when I first started to practice in the field of nephrology or kidney disease, we really focused on dialysis and really kind of trying to help people with dialysis or glomerular diseases, and sort of kidney disease in the setting of diabetes was really kind of looked at as, okay, if you just control the glucose, you control the blood pressure, there really wasn't much else. And that was it. And now we have a completely different mindset. So within the past 5 years, we have 14 new medications in the field of kidney disease. Specifically for people with diabetes and kidney disease, we have the SGLT2 inhibitors. That's the empagliflozin and the dapagliflozin and the canagliflozin. And all of those medications help people with diabetes to reduce their risk for heart failure, reduce their risk for myocardial infarctions, and reduce their risk for kidney disease progression and kidney disease, and keeping them off dialysis. So especially if you have diabetes and you have kidney disease, you really should be asking about those medications. Should I be on those medications? If you're not on them, ask why. And there's also, go ahead.
So, Holly, can I ask you a question? If we look like nationwide, because it sounds like these are really important medicines for people to be on, are most people who have diabetes, who have chronic kidney disease, on these medicines already? What is your sense?
No, it's around 15% right now. And if you look maybe 2 years back, it was around 5%. So we're still way, way behind. So those medications came out about 5 years ago. And so we're way behind. Those pharmaceutical companies advertise on television. And I usually am not a fan of direct-to-consumer advertising, but I think for kidney disease, it's really important to try to get patients to know that they have options for them. And these medications, if you have kidney disease, they reduce the risk of kidney failure by about 50%. So like if your risk is like 1.8%, it'll take your risk down to like 0.8%, which doesn't sound like a big deal, but it's actually really huge for us. That's a huge deal. To reduce your risk by 50% is a big deal, big deal.
It really is. And, it's practicing in primary care as I do. We have so many things that have changed over the last few years. It is honestly challenging for people like myself to keep up with everything. This is an area where the changes happen quickly, as you said, about 5 years ago, and the change is large. So one of the things we're trying to do is have not just doctors learn about it, but people who have diabetes learn about it as well. Now, they're used for people with chronic kidney disease and diabetes, called diabetic kidney disease. How would one of our listeners know if they have diabetic kidney disease or if they're at risk for diabetic kidney disease?
So here's the thing. If you have diabetes, you are at risk for kidney disease. It's about 40% of people with diabetes will develop kidney disease during their lifetime. So you're already at risk. And you will not know it unless you get tested, because kidney disease 95% of the time has no symptoms until you're ready to start dialysis, which is around about 50% of people who initiate dialysis do so like what we call crashing on dialysis, where they go up to emergency room because they feel kind of short of breath and they're told, hey, your kidneys have failed. So we're trying to change that by trying to get screening for kidney disease in high-risk individuals like people with diabetes. And it's really simple. All you do is a blood test for your creatinine, and that's like any basic metabolic test that tests for your sodium, your potassium, your bicarbonate. That basic metabolic panel also has a test in it called creatinine, which is a garbage product of muscle metabolism that your kidneys get rid of in the urine. So if your kidneys are not working right, then that creatinine level will go up a little bit. I have teenagers. It's like teenagers not taking the garbage out, right? The garbage is kind of accumulating in your house. And so we use that creatinine level to calculate what's called your glomerular filtration rate, which basically your kidney function. And so a high creatinine level means the kidneys are not taking the garbage out, low kidney function. So that's the first step. But then the second step is to do a urine test that measures how much albumin, a protein, is in your urine. So your kidneys are filters, right? So they're filtering the blood, and you want to get the bad stuff out, like the creatinine, but keep the good stuff in, like the albumin. But if your kidneys are damaged, then it's just like a leaky roof on a house, right? The albumin spills into the urine. So it means like your shingles are not intact on the roof of your house, and a roof that's leaky that house isn't going to last as long, right? So albumin in the urine is like a leaky roof, and it means that it's damaged. And so the higher the albumin in the urine, the faster the loss of kidney function will be, because it's not intact, it's damaged. So just like a house with a leaky roof, the more that it rains on there, you're gonna ruin your aluminum, flooring in your kitchen, and ruin your shag carpet. If you grew up in the 80s, right? We all had shag carpet, and it's not gonna last as long. So you need those two tests to really determine what your CKD stage is. So the lower your GFR, your kidney function, or the higher the amount of albumin that's spilling into the urine, the leakiness, then the worse off you are. But that being said, that's the bad news, right? That you could have advanced kidney disease and not even know it. But the good thing is, if you get that detected, there are things that we can do to help you and keep you off dialysis and stabilize your kidney disease. So number one would be the medications that we talked about. There's also another medication called finerenone that you can use for type 2 diabetes. And then you also should be on like what we call ACE or ARBs. That's like the lisinopril or losartan. And those are standard medications for your blood pressure. And then you want to make sure your blood pressure is well controlled. You need to hook up with a dietitian, because remember, your kidneys are the last step for protein metabolism. So if you need a nice big steak, it's not just your stomach that churns up that steak. All of those amino acids have to get metabolized by your kidney. And your kidney also has to do a lot of other things with your nutrition. So you have to think about your kidneys as being a nutritional organ. So a healthy diet's critical for maintaining the health of those kidneys. So hook up with a dietitian and get counseling. And that is free for anyone with diabetes or kidney disease, regardless of diabetes. You can get medical nutrition therapy from a registered dietitian with no copay. That's part of Medicare, and most private insurance also offers that. That's part of your preventive services that you get. So ask your doctor to refer you to a dietitian to get advice on what you can do to maintain your kidney health. If you have kidney disease, you should not be taking over-the-counter medications, except for Tylenol, but you don't want to take like Advil or Motrin or ibuprofen. You don't want to be taking herbal supplements, all these things that have weird names in it. I always tell my patients, if it has some kind of weird name, I wouldn't take it. If it's like vitamin B or D or something, that we've all heard of, fine. But if it's something that's going to make me kind of go, tilt my head, like, what are you talking about? Probably shouldn't be taking it. So the other last thing would be exercise, which is great for diabetes, but exercise is awesome for the heart and for the kidney. So you don't have to do a huge amount, but just walking around the block or using, some kind of stretchy bands or weights, anything you can do to move those muscles is really beneficial for the kidney as well. Gave you a ton. I'm going to go over it one more time. Okay. It would be the specific medications for diabetes and kidney disease, right? And then the ACE or ARB, which are blood pressure medications and getting your blood pressure well controlled, the diet, hooking up with a dietitian, and the exercise, avoiding over-the-counter medications that are not necessary.
Holly, that is fantastic. And I particularly love your holistic approach, right? Like eating right, clean eating, exercise, important for health in general and the kidneys, and then the medicines that you mentioned. We only have a few minutes left. Can I ask for any last thoughts from our panel? First, Tiffani.
If anything, I would like to encourage anybody who is, has type 1 diabetes. It is not a lost cause. So much research, and there's so much, advocacy everywhere. I mean, it's getting so much, attention, and there's so many resources available that I've seen, over the years that just, quite frankly, we didn't have, some decades ago. And so I would encourage, for you to lean in and lock in and really take your health in your hands.
That message is so important. It's about health. Sometimes we focus on treating disease, but what the other focus needs to be is on health, healthy communities, healthy people, eating clean, moving around. And now, Holly?
Well, I would say ask about your kidney function. Ask your doctor, how are my kidneys doing? So you probably do that with your cholesterol, right? You say, hey, doc, should we be checking my cholesterol? Is my cholesterol okay? So we started doing that in like the early 2000s, right? You remember being forced to start asking people and screening for lipids and cholesterol? Same thing for the kidney disease. Ask your doctor, how are my kidneys doing? And remember that a kidney screen includes a blood test and a urine test. And about 60% of physicians are going to forget the urine test. So ask them about it. Say, hey, but what about my urine? Is my urine okay? Am I spilling any kind of proteins in my urine? I heard I should be getting that checked. Get that checked, because sometimes your kidney function may be normal, but you're spilling the albumin in the urine. So make sure you get both of those tests. And the last thing is, if you do get a diagnosis of kidney disease, do not lose hope. We are not in the 1990s anymore, okay? We are able to keep people off dialysis. And if you're really concerned about it, see a kidney doctor and really ask about those medications. Can that help me? Never lose hope.
Holly, I love your message, and it's so consistent what we're doing again and again with these podcasts is trying to empower people with diabetes with knowledge in order to ask the right questions, because if you can ask the right questions, you can then find the right answers. And Sarah, your thoughts?
Yes, I think this was fantastic conversation. One theme that's standing out to me is to use your care team. There are many different members of the care team who can help you to best protect your kidneys, whether that's helping to support you in your day-to-day self-management behaviors by working with a diabetes care and education specialist. You might work with a pharmacist to optimize your medication therapy in collaboration with a primary care provider, or nephrology experts like Dr. Kramer. So using all of these members of your care team can really help to best protect your kidneys. I also want to point out that there are a few places you can go to learn more about kidney disease overall and the relation between diabetes and kidney disease. The first is the American Diabetes Association, of course, has different website articles and stories and resources about diabetes and kidney disease and what you can do to decrease your risk. I'd also like to recommend checking out the National Kidney Foundation, which also has many different informational resources about diabetic kidney disease. And they even have an article specific to preventing diabetic kidney disease. So there are plenty of places you can go to learn more.
Fantastic. Sarah, as always, thank you for co-hosting our podcast.
Of course. Thanks for having me.
And Dr. Holly Kramer, Tiffani Martin, thank you both so much for joining us.
Thank you.
Thank you.
And of course, thanks to our audience, because you are who makes this worthwhile. Thanks for tuning in, and tune in again next month when we'll be discussing technology in diabetes with a particular focus on continuous glucose monitoring, or CGM. For the American Diabetes Association, I'm Dr. Neil Skolnik, and thanks for listening.